The first month of your child's life can be a huge period of adjustment for any parent, and newborn for that matter as well. In this video, I wanted to cover a couple of the major milestones you should expect your child to hit by the end of the first month. If you're new here, hello and welcome. My name is Jenny. I am a certified teacher, a doctoral student, and also a parent of two lovely daughters. I have Mina here, who is just now 1 month old, and I also have Alice, who is my 17-month-old daughter. You might think that all a 1 month old can do is eat, cry, and sleep, and honestly, that is the majority of what they're doing, but they develop so much in that first month. You'll be so shocked at how much they develop from the first day to the last day of the first month. So let's talk about a couple of the milestones you're going to be looking for, and then at the very end of the video I'm going to include some red flags that you'd want to bring up with your pediatrician. Now, I'm not a doctor, so you should always rely on your pediatrician's advice above anything else, but I figure this might be helpful for you to make sure that you are watching your baby's development and that they are developing on track. So the first big milestone that you should be seeing, and this is kind of a basic one, is they should be eating well and sucking well. Whether you're feeding formula or express breast milk or breastfeeding, they should be feeding well and gaining weight. So one thing that we really like to do is weigh Mina every so often to make sure that she is gaining weight, because that is obviously a major milestone. By this point, if your child is a month old, you've probably already been to the pediatrician at least twice. So you should probably already know if they are gaining weight, but that is the first thing that you're going to want to see, is that they are sucking effectively and not super slowly, and they are actually transferring milk from however it is that you feed them. So let's talk about some of the physical milestones that you might see for your baby. One of the first ones is jerky quivering motions. So if you see their arms, they kind of tend to jerk and quiver a little bit. I'll insert a clip so that you can see Mina's jerky quivering motions, what I mean, and you know that your baby is on track if they are exhibiting these different quivering motions with their arms and legs. Something else you might see a little bit more often too is bringing their hands to their face. This is well on their way to putting their hands in their mouth, which is always a good thing because it leads to self-soothing, which makes your life a lot easier. Something else that is very common and considered a milestone is that babies will keep their hands in tight fists. So you should see them have their hands in fists most of the time. So Mina right now, actually, if you can see, her hand is in a tight fist because she is nice and asleep. Now, after you feed them, immediately after you feed them, sometimes they'll have that open palm, and that's how you can tell that they have eaten well, but generally speaking, they have their hands in little fists. Newborns also can hear very well, and they can sometimes distinguish parents' voices too. Now, there's not a real way to interact with this necessarily other than just talking to your baby or singing to your baby. I know for Mina, it does tend to help when she hears one of our voices, mine or my husband's, to calm down when she's having those colic episodes. So that's one thing that you can look for with your baby, is being able to differentiate sounds. They have really good hearing. The last gross motor milestone I wanted to talk about is that if you put your baby down for tummy time, they should be able to turn their head from side to side. Now, that does not necessarily mean that they're picking it up fully off of the mat, but you should start to see a little bit of that towards the end of the first month, is that they're able to hold their head up for a few seconds. But if they're not yet, all you're really looking for is that they can turn their head from one side to the other. And usually you will see that if you put them down for tummy time on a mat. Now, remember too that tummy time does not have to just be on a mat. I know for Mina, she does not love being on a mat, and you're going to see that in just a second. She also does well with tummy time on my chest, and if you like to hold your baby on your chest, if they're getting that side-to-side motion with their neck, that still counts as tummy time. A couple of the cognitive milestones you might see at the end of your first month of life for your baby is being able to focus on an object about a foot away or a little bit closer. Babies' eyes are not completely developed by the time that they're born, so you want to see that they can focus on something pretty close. So kind of the perfect gazing distance from Mina's face right here to where I am. And believe it or not, one of their favorite things to look at is actually human faces. Above all else, they gravitate towards human faces more than anything else. Mina! Mina! Looking at mommy? Something else that you can do with your baby that they really enjoy looking at is high contrast pictures. Now I have a couple of different things that I use with Mina. I have 2 different books. There's one that's called Hey Baby Animals, and I'll put a picture of it right over here. And then I have Hey Ocean Friends, and I'll put a picture of that one over here as well. Believe it or not, my daughter Alice, who is 17 months, still likes these books, so they're actually a really good purchase for toddlers and also infants because they have very high contrast black and white pictures. Something else that I have for Mina that she really likes is this Baby Einstein mirror, and on the back side of it, it has high contrast picture cards, and so she really likes to look at those and kind of focus her eyes on what she's seeing there. So I'm going to show you a little clip of Mina enjoying looking at those cards as well. So we've talked a little bit about the milestones for your 1-month-old. Now, there's not a huge list for the first month because their main goal is to just gain weight and grow and get bigger and stronger and more efficient at eating. But there are that couple of milestones that you can look for. I want to mention at the end here though, a couple of things that would be a cause for concern that I would bring up with your pediatrician if you're seeing. One of the first things that I would bring up with my pediatrician if I noticed it would be if your baby is overly floppy. So what I mean by overly floppy is they're not really doing those thrusting hand motions, or when you pick them up, they're kind of like a sack of potatoes. Those sort of things. Overly floppy babies is a concern for sure to bring up to your pediatrician. Now, obviously you have to support their head. You see if I'm moving my arm here, Mina's head is moving. That's normal, but overly floppy babies, that's something you'd want to bring up with your pediatrician. Something else you might want to bring up with your pediatrician if it's happening is if your baby does not focus on objects. So that can be anything. It can be the human face, it can be a high contrast picture card. If your baby never focuses on objects, that would definitely be something I would bring up with the pediatrician. There might be some sort of vision problem that you don't know about, and obviously the earlier that you can get ahead of things, the better. The third concern that I would bring up with a pediatrician is if your baby does not have that startle reflex or does not react to loud sounds. That is something that most babies do, and I'm sure you'll notice it if you close the door too loud, they might jump and startle. If they don't ever do that, then that would be a cause for concern, and I would definitely bring that up with your pediatrician. So the last one I wanted to mention that would be a cause for concern is if your baby does not move their arms and legs in a jerky motion at all. If they don't move their arms and legs at all, that would be a cause for concern. Also, if they're not transferring enough milk, of course, you probably would already know that by now at the end of the first month, but if they're not gaining weight, that would be a cause for concern as well. So how is your 1-month-old doing? How are you doing? Because obviously, having a 1-month-old is really hard, especially when you also have a toddler. It is hard to get to anything at all. I hope that your 1-month-old is doing well, and I hope that you are surviving and taking care of yourself. If you like this video, give it a thumbs up, consider subscribing. I'm going to do a whole milestone series with little Mina here as well as my daughter Alice. So if you're looking for milestones or just general commiseration with having a 1-month-old, I would love to have you here. I appreciate you watching, and I will see you next time. Take care.